The following segment is sponsored by Northern Nevada Health System.
We're here with Kevin Wright, a sports medicine physical therapist here at Northern Nevada Medical Center, and we're talking about sports physical therapy versus traditional physical therapy and how they're different, Kevin.
Yeah, so sports physical therapy is a subset of orthopedic physical therapy. Our specialty is a little bit more working with athletes and bridging that gap between traditional rehab from injuries into more of a sports performance and performance-based rehab.
So is physical therapy for sports just for sports injuries?
By definition, yes, but a lot of our athletes are all age spectrums, from kids all the way up to adults. And as long as they're active, they're considered an athlete.
So how can a sports physical therapist determine when an athlete can return to that sport safely? Does it depend on the sport, I'm thinking?
Yeah, it does. Yeah, it depends on a lot of different factors. We need to get that athlete back to being strong, right? If it's an injured leg, that injured leg needs to be just as strong as a non-injured leg. They need to be able to, get a return to run program going. They need to be able to jump and land with good mechanics. And they also need to mentally be prepared to get back to competition.
Muscle tension is something you deal with. Why is it so important to release that muscle tension before getting back into your sport?
Yeah, it's a good question. Muscle tension can really affect our joints and how our joints mechanically move. A lot of different ways we can alleviate some muscle tension. We can go directly to the muscle and do some soft tissue work, whether that's with our hands or a foam roller. We can dry needle, and some of our therapists are specialized in dry needling. But oftentimes what we need to look at is the joint itself. If that joint itself isn't a stable joint, if it's moving a little too much, a lot of these muscles get tight and they get hypertonic, as we call it, to help try to stabilize that joint. So a lot of times there's more to it than just directly looking at the muscle.
So you get in there, look at the whole body, and then try to figure out like a puzzle what needs to be alleviated and when and where.
Absolutely, yeah. The common complaint is we hear people with this upper trap tension. That this is where I carry all my tension. A lot of times that tissue is not the fault. It's either their neck might be moving too much, and that muscle is trying to stabilize. Their shoulder is the same issue.
That's why we come see a guy like you.
That's right.
All right, yeah. Kevin, thanks so much for your time. And for more information on this, go to our website, foxreno.com.